The question I have, though, and I want to stay with you, Cathy, for a second here, is about this privacy piece, because I think that that's one of these areas of concern. If we talk about some communities, and I think that it's fair to say that there's some good data out there that minority populations that are particularly impacted by health disparities may not all be very comfortable with certain types of information sharing out of concern that that information or data is not going to necessarily be kept private. Um, what kinds of things, as you think about that diverse population of people or the diverse populations you take care of, what kind of measures are you putting out there to ensure that privacy is kept kept sort of sovereign, if you will, by your systems?
And it's a tricky wicket, right? And it's one of those things that has to be a combination of strong authentication. We have to know who we're looking at and what we're doing. Interestingly, just a few years back, we were seeing your cell phone as being something special. Now your mobile device is actually part of your care plan, right? So being able to create a chain of custody that incorporates all of the digital devices, my wearables, my elements, my whatever it is me, but I am actually ultimately the owner of my patient information. So what we need to be able to make sure is that we've got clear and strong authentication methodologies that are not exclusionary, right? We have to make them easy enough to use. Right? Anybody who's tried to talk a senior through multi-factor, push your 87 different forms of identity knows that that's an absolute fail. So it
Right.
has to use interesting things like my face as my authentication. How does that feel? And how can we create that so I'm not actually capturing your image, but I'm capturing metadata about your image, and I can tie that into those really focused entry points. How do I make sure that when I'm leveraging internet-based connections, that I'm using a technology like software-defined perimeter that allows me to slice in very quickly. So I'm creating a stream that's secure. So I actually can't have my data hijacked. You know, there's statistics that are out there that are showing now that health information, health cards, health data is probably one of the most valuable black market elements, you know, dark web elements that are out there. So how do we protect those things? And I think that's really about strong security at the front. It's people working together, and it's making sure that those technologies that we're building in play are leveraging the best of breed that we can without making the gate so high that people
Right.
avoid it, right? We can't make it so hard that nobody uses it.